In this video, I'm going to give you 4 drinks that I'm going to recommend to get your heartburn taken care of. And then at the very end, I'm going to give you 5 drinks I'm going to recommend to avoid so you don't have worsening acid reflux. If you're suffering from reflux, you're wondering what can I do to minimize it, to help it, but also to avoid, this video is for you guys. Let's talk about food. Howdy, I'm Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic. I have over 10 years of treating thousands of patients with heartburn. I'm going to give you my exact protocol that I recommend to get your heartburn taken care of. If you haven't already, consider subscribing to this channel and come see us at Gastro for all your GI needs. So drink number 1 is easy. It's just water. Plain old water. Simple water. Easy water. Water works. Water is a very effective way to treat heartburn. It helps to treat it naturally, helps kind of calm things down, brings that fire hose into the fire that's going on into your esophagus. Too many of us, including myself, have heartburn because we actually don't drink enough water. All of our stomach is filled with food, which produces acid, and that acidity is why you have the heartburn. By adding more water into your food, into your diet, into your stomach, it helps to neutralize the acid and neutralize the food as well. I recommend having your stomach 1/3 full of food, 1/3 full of water, and 1/3 full of air. This combination will help minimize the heartburn symptoms that you're having. And so incorporating something as simple as water is safe, is effective, and actually makes a difference. Number 2, alkaline water. Now, alkaline water actually has a base to it, which has been shown in some clinical studies to help neutralize the acid in your stomach. Now, I have to stress the data is not that robust when it comes to drinking alkaline water for heartburn, but there is some evidence that can help. And so if you're having heartburn symptoms and you want to try adding alkaline water, consider trying and seeing how you do. Typically, the recommendation is at least 16 ounces of alkaline water per day to get the effect of treating heartburn symptoms. And alkaline water is less acidic than pure water and actually may inactivate pepsin, which is an enzyme that helps promote acidity in your stomach. Drink number 3 are herbal teas. Herbal teas are natural teas that have been shown to help minimize heartburn symptoms. Most herbal teas have anti-inflammatory effects to help neutralize the acidity and the irritation going on in the stomach. And if you have a tea with curcumin, it actually may help prevent reflux. Now, the exception to this rule is mint tea. Now, mint tea has been shown to help actually increase reflux symptoms. So of all the teas you want to incorporate, you may not want to incorporate peppermint tea because that may make your reflux symptoms worse. And then tea number 4, aloe vera juice. Now, I know you've seen aloe vera juice and aloe vera used for helping out the wounds and also maybe taking aloe vera to help out with reflux. But I actually recommend the liquid form of aloe vera because it actually helps to coat the stomach. What we think is going on with aloe vera is that we think it's actually helping to manage the acidity that's going on in the stomach. We think that when you add in aloe vera, it actually neutralizes the acidic component to help make more of a neutral pH to minimize acid. Not only that, aloe vera can act as an antioxidant to help prevent peptic ulcer disease. All right, now that I talked about the drinks to incorporate into your diet, let's flip that script. And I'll give you drinks I'm gonna recommend to avoid to help out with acid reflux. The first one's coffee. Now, there's some controversy when it comes to coffee and reflux symptoms. Let me tell you my story. So I have bad acid reflux, but I drink coffee because I love coffee. But I know if I drink too much coffee, my reflux would get worse. So the moral of the story is see how your body feels. We do know that coffee and caffeine and the oils in them can help open up that sphincter longer and more often when it comes to acid reflux. We know this for a fact. Now, each person is individualized when it comes to acid reflux. When it comes to the specific coffee itself, we have found that actually a darker roast is easier for heartburn than a lighter roast. So if you're going to go for coffee, do what I do. Have only 2 cups in the morning, have a darker roast, and don't combine that with something that's gonna make your acid reflux symptoms even worse, like spicy foods. Number 2 is alcoholic drinks. Now, what alcohol does is that it helps relax that lower esophageal sphincter. This is the root cause of why you have acid reflux. When the sphincters open longer and more often, it causes acid to go up into the esophagus to cause burning, heartburn, pain, and all the reflux symptoms from this. And that effect actually gets worse if you drink more alcohol in a short amount of time. So if you're chugging that alcohol down, guess what's gonna happen? You're gonna have worsening acid reflux as a consequence from that. But not only that, alcohol actually acts as a toxin to your esophagus. So alcohol in combination with acid reflux will substantially increase your risk of developing esophageal cancer. Drink number 3 are citric drinks or acidic type drinks. So cranberry juice, grape juice, apple juice all have a lot of acidity to them naturally. And that acidity, combined with the acid in your stomach, will make your acid reflux symptoms worse or more intense. Next are carbonated beverages. So what this does, it produces a lot of gas inside your stomach. You know this, you're literally drinking in gas, but that gas has to be expelled somehow, somewhere. And the way it's going to be expelled is by you burping that. And so by burping, you're actually opening up that sphincter again, longer and more often. You see a common theme here. All of these drinks is that they increase the opening of the lower esophageal sphincter. And that opening leaves that door wide open, acid to go up. And this is what carbonated drinks do. Another clinical clue here, if you have bloating, don't drink drinks that cause more bloating like carbonated drinks. And then lastly, milk-based beverages. These have a lot of fat in them. And that fat also, once again, opens up the lower esophageal sphincter to make acid reflux symptoms worse. Now, I know I gave you a lot of tips, things to avoid, things to incorporate, but what I tell all my patients is that every single person is different. And so try and see what works for you. If you don't have issues with coffee, don't sweat it. If you have issues with certain waters, use that instead. And so even though I'm giving you general advice, use your body as a way to determine which device is practical for you in particular. When it comes to food and drinks and reflux in general, we know that not everyone's going to respond the same, and the data is not that good. And so what I tell my patients in my practice is that try these things out, see how your body does, and then based on that, you can make a change if you want to get your reflux symptoms taken care of. So my question to you today, have you tried these changes? Has it worked? What's worked? What hasn't worked? What has been your response? Comment down below. I would love to hear what you guys have to say. Well, thank you for watching. Don't forget to smash that like button, like, share, and subscribe. If you want to learn more, come see us up at Gastro or watch my other videos on what you can do to help manage your acid reflux symptoms.